On COVID, I think today may, in retrospect, look like a landmark day for what appears to be a new phase of the COVID response in our country. We've been watching really worrying headlines over the past couple of weeks out of southwest Missouri, particularly out of Springfield, Missouri. Missouri broadly has less than 40% of its population vaccinated. It's apparently even worse than that in the southwest part of the state. And that has had consequences. They've got a rip-roaring COVID epidemic right now in southwestern Missouri, thanks to low vaccination rates and thanks in significant part to this Delta variant, which the vaccines apparently do work against, but it doesn't help you if you're not vaccinated. And the Delta variant appears to be just so much more transmissible than the initial variants of COVID were. Again, for people who haven't had the vaccine. And this is a part of the country where not very many people have had the vaccine. Multiple hospitals in the Springfield, Missouri area last week started diverting new COVID patients to other facilities because they were full up and couldn't handle any more. So the situation we've been watching, and there's been public calls for help out of the healthcare system in southwest Missouri and Springfield, Missouri. Now the federal government is responding as well. They're deploying what they're calling a COVID surge team from the federal government to go help in that part of the country. This is personnel from CDC, Department of Health and Human Services, from FEMA. They're apparently sending an epidemiologist and research assistants and contact tracers to try to get their arms around this rapid spread and big surge in Missouri. Dr. Anthony Fauci, the country's top infectious disease doctor, keeps saying in public remarks these days that he thinks that we are heading into a real bifurcated response now as a country. Parts of the country with high vaccination rates returning to something approaching normal in terms of lifestyle and restrictions and healthcare utilization. While on the other hand, simultaneously, parts of the country with low vaccination rates are sliding back into potentially some of the worst of what we saw last year. Particularly now that we've got the rising presence of this extra contagious variant, this Delta variant that is just ripping through unvaccinated populations now. Again, the vaccines all appear to be effective against the Delta variant, at least initial clinical trials, initial studies of the effectiveness of the vaccines versus the Delta variant show that all of them are effective against Delta. But if you're not vaccinated, the Delta variant is more transmissible than what brought the country to its knees last year. And so that's a dangerous place to be for parts of the country that have lower vaccination rates. And if that means this is what we're going to see now, federal surge teams fanning out to unvaccinated pockets of the country to try to stop situations like what we've got right now in southwest Missouri, then indeed, I mean, it's good that they're innovating new responses, but indeed, this looks like a new phase of COVID in America, a new test for our national ability to respond to COVID. I mean, depending on how this goes and whether this becomes the new sort of contours of the American response, we may look back on this week and even today as a sort of landmark news development for COVID and for the Biden administration's ability to adjust and adapt and react and innovate new strategies to deal with the new problems this phase of the epidemic poses.